Health. In this chapter, you have read that health is a wider concept, that illness. Look at this quote from the Constitution and explain the terms living standard and public health in your own words. An important part of the Constitution say it is the duty of the state to raise the level of nutrition and standard of living and to improve public health. So living standard means the level of living of people at which they live. If they live in hygienic conditions, enjoying all comforts of life, it means their living standard is high. But on the contrary, if they are bound to live in filthy conditions, unclean, unhygienic conditions, and drink polluted water, eat unhygienic food, it may lead, or you can say that they have low standard of living. Public health, it refers to the health of general public. What are the different ways through which the government can take steps to provide health care for all? Discuss. Now, the government can take steps to provide health care for all. How? By increasing the number of hospitals, healthcare centers and family welfare centers, organizing free camps for checkup of general public, organizing pulse polio campaigns, programs, and spreading health awareness among common people through different means. Workshops, seminars, and training camps can also prove to be some of the effective ways. What difference do you find between public and private health services in your country or in your area? Use the following table to compare and contrast these. So how do we write this? Private. The cost of service in private is high, quite expensive. The availability of service, everything is available, but on high cost. While we talk about public, the cost of services is either free or very low cost. And availability of service, there is always rush at the public hospitals. Even though services are available there, but it takes time because of the population. Improvement in water and sanitation can control many diseases. Explained with the help of examples. So water and sanitation, these are basic necessities, requirements for the maintenance of our health. Poor quality of water causes a lot of health problems. Similarly, this poor sanitation causes many epidemics, giving birth to dangerous insects and worms and microorganisms. So recently, we saw the spread of dengue or dengue caused by Aedes. This is a kind of mosquito. Malaria is also caused by mosquito called Anopheles, female Anopheles mosquitoes. And improvement in water and sanitation can control these happenings. What do people in democratic country expect from the government? People in democratic country expect the government to work for their welfare. Where do most doctors prefer to settle? Most doctors prefer to settle in urban areas, that is the cities. Name some waterborne diseases. Diarrhea, worms, hepatitis, these are waterborne diseases. What problem do rural people face whenever they come in a grip of an illness? So they have to travel long distances to reach a doctor. What do we need to prevent and treat illnesses? So we need appropriate healthcare facilities such as health centers, hospitals, labs for testings and ambulance services. What do you mean by public healthcare system? So this is a system of hospitals and health centers run by the government. What happened to Hakim Sheik? On one evening in 1992, he accidentally fell off a running train and he suffered head injuries. Why did Hakim Sheik file a case in the court? So Hakim Sheik filed a case in the court because of the indifferent attitude of various government hospitals that refused to admit him. Who got costly medical treatment, Aman or Aryan? If the name is Aryan, let us say it as Aryan. Okay. Actually, he is Ranjan. So Ranjan got costly medical treatment. Why? Because he went to a private hospital. What did the court ask the state government in Hakim Sheik case? So the court asked the state government to give Hakim Sheik the money that he had spent on his treatment. What is full form of RMPs? Registered Medical Practitioner. Where are they found? So RMPs or registered medical practitioners, they are found in rural areas. Where are private services easily available? Private services are mostly easily available in the urban regions, urban areas, where there is thick population. Why are people or poor people more likely to fall ill? Poor people are more likely to fall ill because they are not provided basic necessities like drinking water, adequate housing, clean surroundings, proper sanitation, hygienic conditions. Why are women not taken to doctor in prompt manner? This is because women health concerns are considered to be less important than the health of men in the family. Define health in broader perspective. This is perspective actually, perspective. So the common definition of health is the ability of a person to remain free of illness and injuries. But health is not only about diseases. It is something more than that. And apart from disease, we need to think of other factors like safe drinking water, clean surroundings, because they affect our health in various ways. If people fail to get these basic amenities of life, they will fall ill. So being active and in good spirits are also essential part of health. We also need to be without any mental stress, because we cannot be healthy for a long time if we are under some mental strain. Mention some positive aspects of healthcare in India. So what are the positive aspects? India has good number of doctors, clinics and hospitals. It is among the largest producers of doctors each year. Healthcare facilities have grown substantially over the years. The number of hospitals have grown from 11,174, that is 11,174 in 1991 to 18,218 in 2000. And you can interpolate or extrapolate to the present year. India gets a large number of medical tourists from several countries. They come for treatment in some of the world famous hospitals in India. India is the fourth largest producers of medicine in the world and also a large exporter of medicines. What are the negative aspects of healthcare in India? The negative aspects are rural people, that is the people who live in villages. They face the crisis of doctors because most doctors, they tend to settle in urban areas. They have to travel, these people have to travel long distances to reach their doctor. About say 5 lakh people die from TB each year. Almost 2 million cases of malaria are reported each year. Clean drinking water is not available to all. As a result, poor people easily become prey to various waterborne diseases like the diarrhea, worms and hepatitis. Half of all children in India do not get adequate food to eat or they are undernourished. Right now, the main features of public health system. So the main features of public health system is that it provides quality health care services either free or at low cost so that even the poor can seek treatment. It takes action to prevent the spread of diseases like tuberculosis, malaria, jaundice, etc. And time to time, it takes up campaign programs to see that mosquitoes do not breed in water corridors, rooftops. And this system is available both in rural and urban areas. What did the court say in the case of Hakim Sheik? The court said that the difficulty that Hakim Sheik has faced that could cost him his life. If a hospital cannot provide timely medical treatment to a person, it means that the protection of life is not being given. So the court also said that it was the duty of the government to provide the necessity of health services. That is, the health services are necessary, provided by the government, including treatment in emergency situations like what Hakim Sheik went through. Hospitals and medical staff must fulfill their duty of providing essential treatment. As various government hospitals refuse to admit them, like people like Hakim Sheik, the state government was asked to give Hakim Sheik the money that he had spent on his treatment. How can you say that adequate healthcare is not available to all? Why we can say that? The reason is that private services are increasing but public services are not, because of which private services are mainly available to certain people. But these services are concentrated in urban areas, very expensive also. Poor people hardly afford them. Whenever there is illness in the family, they either borrow money or sell some of their possessions to pay the expenses. Therefore, the medical expenses cause great hardship for the poor people. That is why they avoid to go to doctor unless it is very urgent. It has been found that women are not taken to doctor in a prompt, faster manner. Their health concerns are easily ignored, and many tribal areas have few health centers and they do not run properly. Compare public health services with those of private health services. So public health services are run by government, that is the state, while private health services, they are managed by, say, some individuals or companies. So public health services provide healthcare facilities either free or at low cost so that even the poor can seek treatment easily. Therefore, money making is not a goal of public health services. So far private health services are concerned, they are run mainly for profit. They usually prescribe expensive medicines. It is common for private doctors to prescribe unnecessary medicines, injections or saline bottles, when only the tablets or simple medicines can do the job, can suffice. Public health services are found both in rural and urban areas, but private health services are concentrated in urban areas mostly. So we often find huge rush, means you can say a lot of people at the government hospitals. People have to wait for hours in a long queue, but private hospitals, they are maintained properly. People don't face such long queues there. What is Costa Rican approach to health services and to total governance? Explain. Costa Rica is a country in North America. It is considered to be one of the healthiest countries in the continent. The Costa Rican government gave much importance to health of citizens. It took an important decision and decided not to have an army. So in this way, it saved money and began to spend this money on health, education and other basic needs, necessities of people. The Costa Rican government believes that a country has to be healthy for its development and pays a sincere attention to the health of its people. So the Costa Rican government provides all the basic services and amenities to all the people of the country, which includes clean drinking water, sanitation, nutrition, housing. Health education has been made an important part of all the educations. All level of students are provided knowledge about health. So the Costa Rican approach toward health is praiseworthy and inspiring for other countries. What major changes were made by the Kerala government in this state in 1996? So the Kerala government made some major changes in the state in 1996. It gave 40% of the entire state budget to panchayats so that they could plan and provide for their requirements. This made it possible for village to make sure that proper planning was done for water, food, women development and education. So in this way, water supply scheme was checked, working of schools, Anganwadis was ensured, and specific problems of village that is pertaining to that particular village was taken up. Health centers were also improved. But in spite of all these efforts, there are certain problems still there, like shortage of medicine, insufficient hospital beds, not enough doctor, but they are being resolved due course of time.